Good morning, everyone. My name is Dr. Judy Cavazos. I am a psychologist in clinical psychology. I've been working at Children's Hospital in Oakland for the last almost 5.5 years, 4.5 of those being with the sickle cell team. Prior to that, I worked at Children's Hospital in Chicago for several years, and I've been working with people with medical disorders such as HIV and sickle cell for about the last 15 years. I'm happy to answer any questions in between throughout the presentation, as long as somebody just lets me know. I can always see the chat box, so feel free to interrupt me when you have a question. All right, so I'm going to present today on mental health and brain health for sickle cell disease. All right, I have no conflicts to declare, and today's learning objectives include learning about why mental health is important and its impact on sickle cell disease, learn about why brain health is important as well and its impact on sickle cell disease, learn about why services and treatment can help better manage living with a chronic medical condition such as sickle cell. And lastly, we want to make sure to learn about different tools that can improve your overall well-being while you live with a chronic condition like sickle cell. All right. So as a psychologist, I always kind of want to put this out there, but mental health is very important. I think throughout the pandemic, we have learned how vitally important it is, not just that our physical health, but our mental health is equally important. And I'm hoping that in the next several years, we can strengthen all of these services because they're just as important as our body. So mental health includes our emotions, our psychological well-being, and our social well-being, because obviously we have an internal world and have an external world. We talk to people in our lives, and all of those factors matter. Our mental health definitely will impact how we think, negatively and positively, how we feel, not just emotionally how we feel, but also physically how we feel. And all of that also impacts how we act. So all of those three things are always tied together, even though it doesn't always feel like it, but they are. Sometimes they're off balanced a little bit, but it's always important to remember that how we think, how we feel, and how we act are all tied together. Our mental health also helps us decide how we cope with our stress. And there are different types of stress, which I'll go into a little bit later. It also helps us decide how we relate to others, to ourselves, and to the world. And lastly, it helps us make healthy choices. Oftentimes when we're not feeling so well, we don't always make the best choices for ourselves, and that's understandable. When we often feel much healthier, happier, we tend to make better choices, but ultimately it's always a balancing act of all of those things. So that's why it's really important to think about our mental health as equally as our physical health. All right, so I put this on here because these next couple of slides, we'll be reviewing a couple of mental health facts, and I know these can be scary, but I always tell people this is not to scare you, it's to inform you. I always believe that when you have more information, then you can do something about that with that information. Obviously, I'm very much into education and knowledge. I wouldn't have gone to school for almost 26 years if I didn't care about those things. So I always think the more you give people this information, then the more they can do something with it. So again, just to let you know, the next couple of slides can be a little bit disheartening, but I also think that there's hope in them as well. All right. So as you probably all have known, throughout the pandemic, things have felt a lot worse for a lot of people. People who are already struggling, it became even harder to deal with things in their lives. People who are doing fairly well started to recognize how difficult things are. We kind of had an idea of, oh, this is what anxiety feels like. And so this has played out a lot throughout the pandemic because it's still kind of going on. So things have changed, statistically speaking, over the last couple of years. There was a trend that mental health issues kind of popped up and became worse over the last, I would say, 6-7 years. And yes, you could probably think of several reasons of why that has happened. But unfortunately, stats in the mental health field tend to lag behind 2 to 3 years just because there's not a ton of money into this stuff yet, but I'm hoping that'll also change. So I'm not going to read every single one of these, but I want to just point out some of the key facts. And again, this is to help remember that mental health, there's a big stigma to it, but we want to destigmatize it. because it is fairly common. As you can see, 1 in 5 US adults live with a mental illness. So that's 51 million people out of the 350 million people, I think, who live in the US. It's a pretty big chunk. So if you and 5 friends, one of you might be dealing with something like this. So it is common. As of 2020, almost 50% of adults had received mental health services in the past year. I think that also has changed because of the pandemic. People weren't utilizing mental health services as much in the past, but I think that has definitely switched and changed, and I think that's a positive thing. It's unfortunate because it was from a negative thing, but I think it is positive that people are now reaching out for services. There are 1 in 6 US youth aged 6 to 7 who experience a mental health disorder each year. Unfortunately, this has also increased. It is hard to be a teenager nowadays. I'd say in the last 10 years, it's been pretty tough on them. It only seems to be getting worse with social media and things like that. But again, the more we learn about things, the more we can prevent and do early intervention stuff as well. 50% of a lifetime mental illnesses begin by age 14 and 75% by age 24. The reason I bring this up because it's really, really important to do early intervention and prevention. Here in the US, we love to do it backwards. Our biggest bucket is in like tertiary care, which means like things are beyond serious. I think if we reverse that and put the biggest buckets in early intervention and prevention, we would do much better, but we're not quite there yet, but the more we could all kind of band together to do these things, the better off we'll all be. Additionally, young adults between 18 and 25 have had the highest occurrences compared to adults 26 and over. The second biggest, I think, hard time in life is this age, this 18 to 25 years old, because you're no longer a teen, you're a little bit more self-sufficient, but you're also just becoming into adulthood. I don't think 18 makes you an adult. Your brain doesn't fully grow until you're almost 30 years old. So you're still kind of cooking it and you're kind of on your own learning some of these things. So that's why it's really important to help people recognize that, yes, these years are very difficult. You are not alone. It's just that we don't talk about it, so it doesn't seem like everyone else is struggling as well. But it's really important to remember that they're not, it's not that they're not trying, it's just that they don't know how. So many times their parents and their family have been holding their hands their entire life because they were children. And that transition over to adulthood is really difficult. So we still need to kind of help support them and scaffold that learning so that they can do much better, because that's all what we want for each other, is just for all of us to do well. And lastly, the incidence of mental health concerns are higher in females than in males. I don't suspect this is actually true. I think it's probably closer to each other. I think females are just more open to talking about it and to admitting that they have challenges. But I do think that we have turned a corner where more men are kind of talking about these things because everybody has feelings. So it's really important to kind of support our young, our old, all of our genders, because everyone matters. And additionally, females tend to seek out more mental health services than males, but I'm hoping that all of us will start seeking out more services because that's why they're there. They're just needed. It doesn't mean forever, it just means for right now. All right, so this next topic, again, I think is a topic that a lot of people kind of shy away from because it is something that they think if you talk about it, then someone will do it. But suicide is not something that everyone does. A lot of people have suicidal thoughts. That is typical. I think most people in that one point in their life have thought about these things, but thoughts are different than attempts. There's a very clear distinction between those two. It's important to talk about the thoughts, because if we don't talk about them, then they can lead to attempts. If we talk about these things, then we can actually prevent them from happening. Unfortunately, the suicide rate has climbed nearly 35% in the last 20 some years. Again, I think life is more stressful nowadays than it was before, in different ways, I would say. So it's really important to kind of acknowledge that it's not just, again, it's just me that's experiencing this. This is a worldwide phenomenon, and that we just have to learn to talk about it because it's important. From 2016 to 2017, there was a 10% increase in suicides of young persons between 15 and 24 years old in the US. Again, I will let you think about what some things that were going on in the world and especially in the US that were going on that could have impacted that. I think there's, even though they say like, well, kids don't know about all the things that are going on in the world. They do. They are a lot more aware of things than they let us know about. But they're smart kids. They know about things. So it's important to remember that on top of that, they're also struggling, and it's important to kind of support them when during these ages. Suicide is the second leading cause of death among young people and 10th leading cause of death in the US. That has also increased over the last several years. Access to guns is a big thing right now. That has actually increased with suicide attempts, the usage of guns. Again, if the more we talk about these things, the more we can prevent them. Every person who has died by suicide, there are 280 people who seriously considered suicide but do not kill themselves. This is why it's so important to talk about this topic. I know it's very taboo. I have been doing this work for the last 15, 20 years, so it's not taboo for me, but I definitely understand why other people feel like that. But at the same time, if we don't talk about it, then we can't help each other out. And lastly, over 90% of people who attempt suicide
Judy,
go on.
sorry to interrupt you, but quick question on the preventable. What's the percentage on people that have actually sought help but didn't receive help, or their support staff around them thought that it wasn't as serious as it was? Do you know because I just had a story of my previous student who committed suicide, and I just came to realize years later that he was seeking help and nobody thought it was like a big deal. Like literally people told him to just sleep it off. So I'm just curious about what the percentage on that is.
Yeah, I'm so sorry to hear about your student. That's horrible that someone just said kind of just swept it under the rug. I actually am not sure. I do know that the likelihood of if you receive treatment, the more likely that it's not going to happen. But there's always things, people fall through the cracks, right? People are really good at, unfortunately, covering things up even when they're in treatment and services. Unfortunately, I do believe that if someone really, really wants to do it, they will do it. And I get it in some ways, because I always tell people, think about the worst physical feeling you've ever had. Think about the worst emotional feeling you ever had. Put them together and compound it for an extended period of time. No wonder someone doesn't want to live. Like, that's a lot of weight to carry on somebody, and then they feel like they're a burden to somebody else, so they don't want to talk about it because they feel like, well, no one's going to care, or I don't want to make it worse for them. And so it's this horrible cycle, and that's why it's really important to really talk about these things. I do think, I haven't heard of too many people who have been in treatment and completed suicide, but it does happen for sure. The hope is to reduce that number every single year and every single time, because I think the more we put people in services and they recognize their needs, that it'll be better off in the long run. But I could look into that for you and get back to you if I can find the stats for it. Like I mentioned, there's not a ton of research in stuff like this. It's improving, but it always lags behind a couple of years as well.
Yeah, no, I totally understand. Yeah, that would be appreciated. It's only because, sometimes certain institutions do need to be held responsible because people do seek help, but then sometimes, like you said, they get swept off, or they don't think it's as serious, or, different things.
Yes, I agree. And as part of, being in the mental health field and system, I'm like, it's not a system. We are the system. We are the people. There isn't no magic machines pulling all the strings to everything. We are the systems. So it's important to hold ourselves accountable to that. But we also need support from our patients and our communities, because we all have to do this together. I think when people just blame it on the system or just really on the people, then it's always this back and forthness. But ultimately, we're all responsible for each other. And so working together is going to help out immensely, but it's also hard to do that when we all have different ideas of what help means and how we can get there.
Right. No, that makes sense. But yeah, I mean, more importantly, like if someone is literally saying they need help, like take it seriously.
Absolutely. Absolutely. Thank you for your question. So why does mental health impact physical health? It's very important to recognize the mind and body connection. Back in the day, and I don't mean that long ago, mental health wasn't even considered something that was important. My field has only been around for like 120-ish years, but we were considered a soft science, meaning that it wasn't really science. Luckily, because of all of the advances we've made in technology, we have recognized that no, your brain and your feelings are just as vital as your physical health. So always remember that both of them are equally important factors in our overall health and well-being. So as I mentioned before, our thoughts, our feelings, our beliefs, our attitudes can all positively or negatively impact our functioning. That's not just our mental health, but also our physical functioning. Unfortunately, there are certain symptoms or conditions that impact us more than others. For instance, depression increases the risk for physical health problems, and vice versa. A chronic health condition will increase the risk of mental illness. Oftentimes, people with chronic illnesses do have a higher incidence of depression and anxiety. And I always think, of course they would. Why wouldn't they? There's a feeling of like, my body betrayed me. This is the only body we get that I'm aware of. And so when you're in it, you want it to work as well as everyone else's. And when it doesn't, it just feels bad. And then having to be reminded that every single day that I'm sick or not functioning as well as everyone else is a kind of reminder of that. So it's understanding that people will get depressed about these things. So it's really being sympathetic and empathetic towards them, but also reminding them how resilient they are because they're living with a chronic medical condition. Illness-related anxiety and stress can trigger symptoms of depression, and again, vice versa. So somatic complaints are something that we hear more often, especially in younger people, some older people, more in males, and certain ethnicities. It tends to come out as somatic complaints like, I have a stomach ache, I have a headache, my body aches, instead of saying I'm sad or I'm angry, I'm frustrated. Where we socialize people to have an easier time saying I'm angry than they are saying I'm sad, which they're both feelings, they're both valid, they're both important. Anxiety will create tension in our body, like physically. We don't recognize how much tension we hold all the time. If you're stressed out, your muscles are literally tensing up, but you don't always recognize it because of the fact that it's been going on for so long. But it's really important to kind of help your body relax even through the stress. What your body is doing when you're, depressed or anxious, it's literally preparing to fight, flight, or freeze, because that's the way that we defend ourselves emotionally and physically. And that system is supposed to be in place when there is something that's dangerous, either psychologically, emotionally, or physical, but it's not supposed to be the type of system that we're in all the time, and toxic stress will lead to that. Depression can also impact our thoughts. It definitely distorts how we think and how we see and view things and ourselves in the world. Because when, your hormones literally do change. And so when you have less endorphins, which are happy hormones, you are going to see the world a little bit differently. But also it's important to know that changes over time. It's not like we're always at this certain level. We are very complex systems and we're constantly changing. So it's important to remember. Research suggests that people who have depression and another medical illness tend to have more severe symptoms of both illnesses. So again, that's why it's so important to manage our physical and mental health. And with a disease like sickle cell, the body is already impacted. As we know, pain is the main hallmark symptom. So you're already feeling a lot of tension, a lot of hurt in your body. So when that happens, it's understandable that you're also tend to be depressed or anxious because of those things. And that can contribute to further pain, and kind of it cycles back and forth. So that's why it's important to kind of manage our stress as well as possible. So mental health doesn't just impact our body, but also our cognitive functioning. So as I mentioned, depression, we can have disordered or negative thinking, difficulty concentrating because you're kind of so focused on things that aren't going well, which is understandable. I think most of us, if things aren't going well, we're focused on that. But the more we focus on that, the harder it is to kind of see the rest of the field. So when we're like laser focused, we got to move our hands out of kind of the blinders and see what else is going on. Depression can also get forgetfulness, memory loss. It's impaired our thinking or concentration. It makes us fatigued because, again, that literal muscle tension is going to tire out your body. There's a lot of anger and irritability that can show up. Instead of looking like depression, it looks like more of anger issues, especially in certain populations, usually little kids, boys, sometimes men as well. It's easier to say, again, that I'm angry versus I'm sad, but ultimately they kind of fall in the same bag. And also, depression can reduce our ability to function across lots of different settings, not just in your own personal life, but at work, school, and in your relationships. Anxiety also impacts our cognitions. So oftentimes when we're anxious, meaning really anxious or even just a little bit of anxious, we have these racing thoughts. We worry about things outside of just the main thing that we're worried about, because it's easy to kind of like pull in the rest into the tornado. We have also difficulty concentrating and focusing. You're overthinking about things. Again, laser focusing on one thing versus kind of scaling back and looking at the big picture. There's lots of feeling of panic and dread, and like the worst is going to happen, which is understandable when you're not feeling well or you're stressed out. It's understandable to feel that way, but also it's a moment in time. It'll pass. It can't always be horrible. It can always be good. There's always that balance of back and forth. And lastly, anxiety definitely has a huge impact on our sleep. A lot of people will tell me, I'm fine throughout the day, but the moment I have to go to bed, everything just comes up. I'm like, well, obviously, like through the day, you're distracted by the millions of stimuli, literally millions of stimuli. The moment you are in bed, you are literally laying still, lights out, eyes closed, everything comes flooding in that had been suppressed all day. So it's not surprising that people get more anxious at night. It's very, very common. A lot of people think it's just them. It's not. It's a lot of people. That's why we talk about sleep hygiene and getting into about an hour before you go to bed, calming your body down, calming your thoughts down so that you can have a better transition to sleep, which is not easy, but it is worth it. So here I just want to think about how would you function if you had a bad night's sleep? As you kind of just learned about some of the ways that our mental health impacts our body and our brain. Think about how would you function if you ate unhealthy food like all the time, or you didn't have enough to eat? And how would you function if you had some sort of stressful event happen? Maybe one big event or lots of small events or kind of all together. And feel free to answer any of these if anyone's willing to share. And if not, that's okay as well. But I'll give a second to kind of let anyone answer if they'd like.
Well, I could tackle the night sleep one. When I don't sleep well, I am irritable. Like you say one thing or look at me the wrong way, oh man. And I don't think I'm sad. I really think I'm just angry when I don't get enough sleep. Like I am just a firecracker ready to go. And what I've learned is my patience is zero. Like when I get great nights of sleep, I can tolerate everybody and anybody. But when I don't get a good night's sleep, oh man. And like for me, luckily, I've been blessed with having a good sleep range of like 6 to 7 hours. I don't need more than 6 hours or 7. So, if I do have like a lot to do in the day, I don't have to like freak out. But yeah, when it's like 4 or 5 hours of sleep, oh, and don't even get me started with 3 hours. It's just like, and then like my body feels lethargic, but not like in the good, like I slept 9 hours, 10 hours lethargic, but like I just have no gas, no energy. So, and and my memory is like not as well. And
Yep.
like, in terms of being able to like balance, it's all just all over the place. So I'm just a mess, really.
Yeah, you're not alone. Most of us are. We just don't admit it. And when we're stressed, it's the first thing that we're willing to give up. It should be the last thing we are willing to give up. I read an article several years ago. I can't even remember it, but it was a small study that said about 70% of mental health and physical problems would just go away if we slept well. That's how vital our sleep is. We sleep a third of our life. So if I lived till I was 90, 30 of those years would have been sleeping for 30 years. It's that important, but we're willing to give it up when we're stressed out. And so I encourage everyone here, don't. Your stress is going to be there the next day, but your sleep is super important to help manage that stress. So it's really important to kind of get into these good sleep habits.
Real quickly, G, with that, have you ever heard of a target sleep range or something like that?
Yeah, so everyone's a little bit different. Definitely no one should sleep less than 4 hours, but everyone's body has a different range. And it also changes throughout your lifetime because oftentimes you need more sleep when you're younger because you're more active, and a little bit less when we're older because we're not as active, but it's still important and every body is different. So I always ask people like, do a sleep diary for like maybe about a month and see how your pattern is, like not just how long you've slept, but how do you feel when you woke up? How long did it take you to fall asleep? Did you wake up in the middle of the night? really, when you wake up in the morning, it's about how do I physically feel? So if I slept for 4 hours, but in the morning I'm just like, I feel great, then 4 hours might be good enough for that one night. Because we don't suggest 4 hours. Usually minimum's 5 to 6, but the range kind of depends on your own body, your life experience, your circumstances, your age, lots of those things.
Judy,
Gotcha.
Yes.
Tony has her hand raised.
Oh, there
Sure.
it is. I just wanted to comment on what happens when you eat unhealthy food. A little bit about the unhealthy food, but I know that I have real issues around dehydration.
Mhm.
I'm older, so I often don't drink water when I know I have to be out a lot during the day
Mhm.
because I don't want to have to go to the bathroom.
Yes.
Um,
Common.
but I also notice that when I'm dehydrated, I don't think well.
Yep.
I get very flustered and frustrated, like I can't, it's like I just don't want to have to think about. And then I'll think, water, you need to drink water. And
Mhm.
I'll start drinking more water. And it's amazing the difference that it makes. You know, my body starts to work better. My thoughts come a little easier. And the worst is when I do something like hamburgers and French fries and ice cream and
Mm.
then not enough water. It's like I'm certifiable. But I am aware of it these days, and I am trying to be more consistent, especially with the water part of it.
Yeah, that's great. And like, we always have to admit, like, no one does 100% good all the time. It is hard, even when you're healthy, it's still hard to maintain that healthy routine. But to think about it this way, 75% of our body is made of water, and every single processes that occurs in our body requires water. So you're not alone, and most people are dehydrated constantly. We're not really good at drinking water, but it is vital. It is vital, vital, vital. But it's hard to do. I also struggle with drinking the amount of water that I should every day. But I also know, like you mentioned, I notice myself having harder times doing things because, again, your body is competing with high-powered cognitions and with just our basics. It's always going to go for the basic stuff. So that's why sleep, hunger, thirst all need to be addressed first before other things can happen.
True.
All right. So as I talked, positive stress, tolerable stress, and toxic stress, there are different types of stress. I know that stress and positive don't generally go together, but a little bit of stress can help us motivate ourselves to like prepare for a test so that we do well. It also helps us learn for the future so that we don't do those things again. So that's what we call positive stress. Tolerable stress is something that we have an adverse experience, can be a little bit more intense, but it's still relatively short-lived. So a lot of our systems aren't meant to be, our systems are more like sprinters versus kind of long-term runners. So it's really important to kind of refresh ourselves once we've had that stressful event, get us back into a healthy place, and then go back to deal with things. And then toxic stress is an intense adverse experience that may be sustained over a long period of time, weeks, months, or even years. This is the type of stress that literally changes our makeup, like our hormones, our brain, our organs, all of that. When we have that toxic stress kind of running through us, can impact so many things. We don't want to get in that space or stay in that space, but I know, especially nowadays, it's really hard. But once we identify something, then we can start doing something about it. And stress, as you can see, impacts everything from your hair. Like people start to lose hair, or starts to go gray, or starts to thin, because our body is giving us a sign that something is wrong. It's our alarm system. It's saying, danger, danger. If you don't do something about it, the noise will only get louder. And most of us just ignore that noise. We should not. We should try to turn that noise off because it's very annoying. So really think about when we're starting to see these physical signs, pay attention. Deal with it. Otherwise, your body's going to make it worse for you. Stress also impacts, like I said, our brain and our hormones. So we have these systems that help us regulate the hypothalamic pituitary adrenal axis, or the HPA. It regulates our hormones, such as our appetite, our sleep, all these other hormones. So it's really important to kind of have that, maintain this nice system. Cortisol is a stress hormone. It increases, and it's supposed to help in moments of stress that we need that fight, flight, or flee system. But once that is done, we need to kind of remove ourselves from it so that cortisol doesn't keep kind of circling our entire body. Because if it does, that will suppress our immune system. Cortisol is supposed to be like a booster shot, like you just use it for a moment and then you're done with it. But most of us have it circulate for longer than needed, and then that's when we get a lot of health issues. Our hippocampus is the brain region associated with learning and memory. So stress also teaches us negative things, not just the positive things. So if you kind of keep doing the same things over and over, that's going to start cementing in your brain. And so that becomes a habit or a pattern. So like not sleeping well, or not eating healthy, or picking fights with the same person every single time. Like that becomes a pattern, and it's harder to break patterns. It's not impossible, but harder. So it's really important to kind of learn to manage our stress well. Our amygdala is also a part of our brain. It's this tiny little almond-shaped piece in our brain that helps control our emotions, mainly our anger and our fear, but also our pleasure. Because again, there's always the balance of things. It definitely gets activated with emotionally charged memories. So that's why you can think about something and then feel very, very emotionally bothered by it immediately, even though it's not happening in the moment. Your thalamus receives the sensory information. It processes your speech, your behavior, your thinking, and learning. So when we're overstressed, that can kind of become complicated. And our hippocampus, again, is that memory and learning center. So it processes our long-term memory, our recall, our strong emotions. So when stress is happening, these systems aren't working as well as they can. All right, so speaking of how the brain impacts sickle cell impacts the brain from a neurocognitive perspective. So right here at this point, we will switch over to neuropsych kind of things. Does anyone have any questions about the mental health aspect? Okay, so we'll go ahead and move on. Recently at work, we were given a grant to do neuropsych testing, and many of you might not know what neuropsych testing, but it is doing different activities that help us understand how your brain is functioning. I know MRIs can show like the picture of the brain, so thinking more of like what the house looks like, but it doesn't tell us always how the plumbing is working. And so neuropsych is something that helps us understand how that plumbing is working. A lot of people, when we ask them how sickle cell impacts their brain, most people did not know, or the most common answer was you can have a stroke, which is definitely true. You can either have an overt stroke or a silent stroke, but it's not the only way that your brain gets impacted by sickle cell. Because as we know, sickle cell is an issue with blood, it also then impacts the oxygen. So everyone who has sickle cell has experienced shortage of blood and oxygen, and that's constantly circling through our entire body, not just our body, but also our brain, and that impacts the quality of the blood that we get to our brain. 20% of your entire blood volume is used solely by your brain, so it's a lot of blood. So obviously, if it's not has enough blood and oxygen, then it's going to impact how it gets developed. Is there a question?
Yes, Robert asked a question. Is taking CBD for stress relief a good coping mechanism for stress, in your opinion?
I think it depends how much are you doing it and why are you doing it? Like if it's like a Band-Aid, no, it's not going to be something that's going to be helpful. If it's a temporary fix, okay, but as long as you figure out your underlying stuff and how to manage the root of the problem, I think that's a better use of our time. But at the same time, sometimes we need quick fixes because we're overwhelmed, and that's okay. I always think about cannabis use as it's like everything else, in moderation. Why are we doing it? If it's something that's healthy and helpful, great. If it's something that's kind of skewing over into not healthy, not helpful, then now you just added one more problem onto your issues. So it's not the best thing. Unfortunately, there's not a ton of research on all of the cannabis type products, meaning like CBD and other things like that yet. But I do think that is changing, and we are finding, like with any other kind of medication. There's negative and positives, but again, everyone's body is different. So if it's working for you, good, but also remember, why are you doing it? Is it helpful? And is it only a Band-Aid? If it's not, then it's okay. If it is, then you have to think of other tools as well. Does that help?
I'm sorry, Tony, did you have a question or just your hand is just up there?
No, I did have a question.
Okay.
Do you have any suggestions or recommendations when someone with sickle cell disease is trying to learn, like completing high school classes or just having to learn things? Is extra repetition helpful, or do they just need more time? Or I'm just trying to figure out how to help somebody who's trying to study for things with this understanding that there may be some deficit in their cognition.
Yeah, absolutely. I think, again, everyone's different because everyone's brain's different. Everyone learns differently. So it kind of depends on what their issues are. So if someone has attention problems, yes, they will probably need more time taking a test. If they have memory problems, that depends too, because is it your short-term memory or your long-term memory?
Mhm.
So it kind of depends on what challenges they're having. I think it's also really important to remember, like, we all learn very differently. Some of us are visual learners, some of us are auditory learners, some of us are kinesthetic learners, meaning we have to do something in order to kind of learn it.
Mhm.
So figuring out what your best way of learning is, that's a good start. And then figuring out what your challenges are. And then once you've identified your challenges, then you come up with solutions to work on those things. So it kind of depends. There are different tools that we can use to strengthen our memory. Reading, I always am a big advocate of reading. It's great for your memory and learning. I know not a lot of people love it, but it's something that can help. Doing puzzles, playing video games. Like, there are actual video games that can help improve your cognitive functioning. Eating well, sleeping well, reducing your stress, all of those things are going to also help you with your learning as well, even though they don't seem like they do, but they really do. Does that
Okay.
kind of help a little bit?
Yeah, it does.
Great.
Thanks.
Of course. So as I mentioned, your brain does get impacted from the moment you are born when you live with sickle cell, because your blood is always, throughout your body. So some people have more complications than others, but all have depleted levels in some way. And unfortunately, there are long-term consequences to having that be a problem from childhood throughout adulthood. So it's really important to kind of identify these issues early on. Again, early intervention, prevention, even just talking to families saying, hey, this is how your child's brain is going to be impacted throughout life. And again, I know this sounds scary, but it's not to scare anybody. It's to let them know there are things we can do to prevent it, to kind of manage these things. Yes, they're going to happen because of the blood and oxygen problems, but there are ways to kind of build in safe ways to kind of help improve those challenges and decrease the challenges over time. So the three most commonly impacted domains in sickle cell are executive functioning, which is the last part of your brain to grow, which is up until about 30 years old. It's all the high-powered things: attention, organization, planning, insight, judgment, monitoring. The next one is processing speed. People with sickle cell tend to have a slower processing speed. It's not because they can't do things, it's just that their brain literally just functions differently than other people because of the lack of oxygen and blood. And it's not their fault. It's not like because they're not good at something or they can't do as quickly. It's just different. It's like asking somebody who is an amputee to run a race with someone who has two legs. No one would be saying, like, you should be just as fast as the other person. It's not like their fault that they had an amputation or they were born that way, but we stigmatize it and say, like, hey, you're the problem, which is not true. It's the disease that it caused this. So how do we now help you move forward so that you can learn just like everyone else, but in a different way? And lastly, working memory is also impacted. So these three main domains are impacted. So a lot of people don't recognize it. They're like, oh, it's just me. But no, it's everyone with sickle cell. It's also everyone in life. These things over time do slow down. It just happens, unfortunately, a little bit sooner with patients with sickle cell because of their blood and oxygen supplies. So what is a neuropsych eval? Because I know that it's not a standard of care within sickle cell. We are hoping to make it one, but the more we inform people of what it is, especially the community, the more that they can kind of say like, hey, we deserve this, just like every other diseases that get this covered under insurance and these services, because you do, because it does impact your brain, literally. I'm trying to talk to insurance companies to let them know this, but it's been a bit hard. So the more that we both can kind of partner together and talk about these things, hopefully we can make changes. But neuropsychology is a specialty field within clinical psychology. It focuses on the way that the behavior and skills are related to brain structure and systems and functioning. So neuropsychologists work with patients across the lifespan. We can test a baby as young as like 2 weeks old to start seeing how their brain is processing information, how they're remembering things, how they're engaging with people. The other thing that's really important to remember is that when we do these evaluations, we're not just identifying the weaknesses, we are also identifying the strengths, because everyone has weaknesses and strengths. And it's really important to recognize both of those. And lastly, when someone is referred to neuropsychologists, we are not just working with the providers to say like, okay, you see this problem, so do we, great, let's talk about it. It's no, what do you see? What does the patient see? What does their family see? What do we all see together, and how can we work together to move forward? Because this is a partnership. So again, yes.
Judy.
Yep.
I know you probably know something about this, but one of the things that comes up when I look at the idea of the neuropsychology is the difference between the way that various ethnicities think and process information and that sort of thing, and whether or not, I know in so many disciplines, how do I say this? I don't like to use the word minority. People of color are often not taken into account. The default tends to be white and male.
Yep.
And so I'm just wondering, in terms of neuropsychology, whether you know about the amount of diversity that's within that particular discipline.
Yeah. So you're not wrong on everything that you've said. This is true with even within the field of neuropsychology, but about 20, 30 years ago, well, probably closer to 50 at this point, they recognize these challenges as well. So for instance, IQ testing in the state of California in public school systems can occur, but with communities of color, we will not use a certain test, because we know that that test was normed mainly on white males. So because of that, the field was like, well, let's figure out other tests. And then there are specific tests. There's the differential ability scale, which is, we call it the DOS. That's also an IQ test that's similar to the ones that are often used, which is the Wechsler scales or the Stanford-Binet. All three of them are equally good, but the DOS gets normed on people of color way more than the other two. So in the state of California, the DOS needs to be used in public school systems when testing someone's IQ. So they are starting to revamp these tools to get normed on people of color and women and other minority populations, because they know that there's a need for that. The sad thing is that these take about 5 to 10 years to develop, and we're constantly redeveloping, and it costs a lot of money to do all of this and a lot of time and efforts. So that's where they're a little bit slower, but they are recognized. And I know that my colleagues, we take all of that into account. I hope that most people in psychology take that into account, because we wouldn't have gone into this field if we didn't recognize people's differences. But at the same time, some people still don't, which is unfortunate. So I always let people know, like, make sure that you feel like comfortable and connected with your provider before you continue working with them, because ultimately they're there to help you, not the other way around. And if you don't feel like they're helping you, then don't keep seeing them.
Okay,
Does that
thank
help
you.
a little bit?
Yes, thank you.
Sure.
I have a question. You do neuropsychology test on people living with sickle cell, correct?
Correct.
What age groups are you working with to do this?
At Children's right now, we have a grant had a grant that was for 18 and over. So for the last year and a half, we were able to screen as well as evaluate people 18 and over. I tried to get them down to 15, but they weren't budging.
Okay, so is that still going on, Judy, or is it, or you said that you had funding, so what happened?
Yeah.
What happened? So is it or is it not?
We're still in limbo. We haven't quite found out if we're going to get refunded. We are trying to think about, even if we're not refunded immediately, we're hoping to change that in general, because these are vital services. It shouldn't, I don't feel like it's okay to have given something and then taken it away for whatever reason. It's not because we're malicious.
Absolutely. And this is very, very important. And
Agreed.
It needs to be, it's unfortunate that you just got funding for it, but it should have been already. And it's amazing. Yes, we all really need to work together to make certain that everyone living with sickle cell should have these tests done so that they understand how they're developing and how they're growing and what their needs are. Just like Tony was just asking, okay, do you have, any ideas about or any suggestions with as far as learning and processing? And yeah, that's all a part of being a person. That's why I always say that I feel bad because for people living with sickle cell, simply because they're always looking at one part of that condition instead of the whole person. Yeah. And that's how, they fall off the cliff, they slip through the cracks and all the rest of that. So, okay.
Agreed. I'm hoping that it'll change, but again, we all have to partner together to make more noise and say, like, this should be a standard of care, and we are working on that. So hopefully we can continue. If not, hopefully in the near future, we will figure out how to fund it so that we can continue to do these services. So just a little bit about the tools that we use. They are standardized, meaning that they're all scored similar in all test takers, because as I mentioned, they are normed on whole populations. They are, like I said, and Tony mentioned, we are working towards better ones for all people. But the selection of tests that are picked is based on the referral question. So for example, if a patient says, I have memory issues, then we're going to look at things that test your memory. But memory is not standalone. No function in our brain really is standalone. Everything works in conjunction together. So for instance, you could have visual memory problems versus auditory memory problems. So they're two different things, but most people don't think about that because we just kind of lump memory into one kind of domain. So we also want to make sure that we test holistically, meaning looking at cognition and intellectual functioning, which is often referred to as IQ testing. But that's not the only thing we look at. We look at achievement testing as well. Even if you're not in school, we still want to know how well are you doing compared to people your age, and that should be at that level. We look at motor functioning because you move every single day. So we want to make sure, is it a physical issue, like your bones hurt, your joints hurt, something's going on with them, or is it your brain is not connecting to your nerves to move your body? So it's really figuring out all these little pieces of the brain. So what happens during evaluation? Because I know not a lot of people have access to this, but again, it depends on the referral question. It could typically last 4 to 8 hours. I know it's a very long day. Breaks are definitely allowed. We can break up the testing into over a couple of days, depending on the person's needs. But typically you would start with an interview, and we ask about your background, your history, to see any contributing factors that have impacted your brain and your learning. We do the testing, which again is 4 to 8 hours, sometimes a little bit longer, sometimes a little bit less, depending on the battery. That's just like the set of tests that we give. Then we write up a report and score, interpret the data. That takes about 10 to 15 hours. That's why it takes a long time. And then we do a feedback session with the patient, letting them know, here are the results, as well as here are the recommendations. Because you all should be getting recommendations, not just saying like, here's your problems. It's here's your issues, here's how to manage them, and here are your strengths, and here's how to keep working with those as well. So what do we test for? Like I mentioned, we try to do a little bit of everything. We do memory, executive functioning, attention, language, visual spatial perception. This is just kind of a small list of the things that we do because your brain's very complex. That's why it's so important to kind of work with it. And again, to destigmatize neuropsych testing, because I know people are like, well, I don't want to get tested. I don't want to find out what's going on with my brain, which I know can be scary. But we also try to help people understand that it's going to be helpful. It's like not wanting to find out what's going on with your heart. I know it's important, so let's figure out what we can do to help your heart. So these are a couple of tests that we give. I know they look a little bit weird because you're just like, what is this telling me? But this measures executive functioning. It's called the Dallas-Kaplan Executive Functioning System. It's the trail making test. So we ask somebody, and on the left side, you will see a number sequencing task, meaning we ask someone where it says start, connect the dots from 1 to 2 all the way to the end to 16. Yes, you are timed. Yes, you can see that there's distractions. So it's always as easy as people think. On the right side, it's another task that we have people do, and it's more complex. So here you go from a number to a letter to a number to a letter. You're also timed. So these things do tell us what is going on with your cognitive flexibility, meaning how quickly can you go from one idea to the next and back and forth, as well as how easily are you distracted? Do you know your alphabet and your numbers? Because those things do change over time, unfortunately. We have another test here.
Judy, sorry, real quick. We've hit the break marker, so I think that last slide was something to kind of take a quick little break on, maybe leave it up if people kind of wanted to try it out. I was very curious to try it out myself real quick. So
No problem.
So let's take a moment now and take about 15 minutes, and we should be back around 12:20. So, and if anyone has questions, you can go ahead and put them up on the chat box.
15
At this time,
minutes.
Nadine, are we doing a survey?
Yeah, I'm gonna send the survey out, but you're saying 15 minutes? We're gonna give 15 minutes normally.
10
wanna do
minutes, 10
15?
minutes.
10 minutes.
You wanna
12,
do
it
10
should be
minutes?
12:15.
Yeah.
Okay, all right.
Well,
So
I'm gonna send the evaluation.
Okay, so Nadina will send out a survey in the chat box for y'all to go ahead and fill out to the best of your abilities, and then go ahead and take a 10-minute break. We should be reconvening at 12:16. So I will be doing these measuring functions right now because they look super interesting. Is there any record that I need to beat? I'm a little competitive. So.
We get timed. So it's not about how quick, well, yes, your timing matters, but we can't tell you those things. We would just
Gotcha.
let you know, here's the task, please do it. And then we would let you know the results afterwards.
Gotcha. Cool. Awesome. All right.
So
go-
Judy,
Yeah.
would you let us know if there's anything that we can do to help you with that grant? Like, do you need testimonies or that sort of thing? If so, would you just let us know so that we can do that? Because you know, I know that this is essential, because if your brain's not working right, nothing else is going to work right.
Right, exactly.
Your body, your life. So anything that we can do to help, we will be happy to do.
Yeah, thank you. We're kind of trying to figure that out. I think down in Southern California, they have much, I think, like better connections with politicians. And so those politicians can go and make laws and get money for sickle cell. Up here in Northern California, we're not as tight with our politicians. So we do have to think about how do we strengthen that so that we can do more advocacy as providers, but as well as a community, because they
Really,
hear.
we have the Speaker of the House. I mean, oh yeah, okay.
But it's interesting too that you mentioned that, because Nadina will tell you, might be able to tell you a little bit more about it, but we're working with a company that's a sponsor of ours, and we're trying to develop a roundtable in October, and we need lobbyists to be a part of that roundtable along with the clients that we have. But you know, it's like you said, finding or like getting them interested in doing something in Northern California seems like tooth and nail right now.
Yep. Yeah.
Yeah, that's important, because Barbara Lee was associated with the Panthers, and the Panthers started a lot of the sickle cell testing for African-American children back in the day.
Yep.
So that's something, yes, she will be hearing from me.
Yeah, I think it's great. Like the more people because again, they hear from providers in a different way than they hear from the community. I think it's important for all of us to work together and to kind of talk about these things because it impacts everyone.
Yeah, and so Judy, if you're available, we're trying to put together a roundtable like Antoine was saying on October 5th with legislators and clients, healthcare providers, and you would be more than welcome to attend if you're so available. We're trying to get our venue together, so we haven't been able to solidify that yet.
We'll have confirmation on that on Monday as an update.
Okay, great. Okay, so once we solidify our venue, then we're going to start reaching out to the Black Caucus, to just various organizations and HIV, whoever, all of it. We got all these suggestions from a pharma company. They're the ones that's working with us to pull this together. So yeah. We've got to start doing more of that. So
Yes.
This is great. This is a great start.
Great. Yeah, I'm happy to help in every way I can. I'm not wonderful at politicking, but at the same time, I think that we have no choice.
Right.
We can't just silence more.
And
we need data. We need data. We need stories. We need it all. We just don't need we need a whole effort from multiple facets. So if you're not good at the politicking, don't worry about it. Antoine and myself can do the politicking. I mean, it's fine, but we need data. We need experts. We need people in the community. We need Tony. We need Barbara Lee. I didn't even know she had that connection. We need all these people to come out in force at the same time, not like one at a time, and which is why we're doing the roundtable, to get everybody in the room at the same time so you get something done. Yeah,
we're not trying to make it big, so we want to try to keep it relatively small to about 20, 25 people tops, so that it can stay more, personal, rather than when you get larger groups and it gets hard to engage in conversation and things like that. So yeah, we are definitely moving in that direction. Excuse me.
Yeah, I think we already have the data in some ways. It's just that, like, yes, you need more data, but you need money to collect the data, but it's back and forth. It's like this vicious cycle.
Yeah, it is. Because we've been doing surveys. We just sent out a survey to hematologists in the state of California, and we didn't get a great response from the survey because we were just trying to get basic information about what do you provide. And, what does your clinic have, or do you see sickle cell clients, so on and so on. But we haven't gotten a great response on that yet, but we're still working on it.
Yeah.
And that's what you got to keep doing. What they say, the squeaky wheel gets the grease. So, we just got to keep, being vocal, and all of that.
Agreed.
Nina, I know I'm in the process of working with Sunjata. We're trying to find some place, because we know he's about to have to transition. And so we're going to interview Altabates. I've heard that they have a program. So if there are any,
I got an email today too.
Yeah, if there's any bits of information I can pick up for you.
It was like they sent a link saying, did you look and see which of these pictures you like? And they had a link or something.
Oh, and where did that come from, Shirley?
Well, it's not nice. It's the state of our world, but I think it's good that you have the wisdom not to open that stuff up,
Okay. Well, I haven't gotten anything, so I don't know.
Right. Cool. Yeah. So how are you doing?
I'm well. Yeah, I had COVID for a while. We all had COVID for a while, right? But I'm good now. So yeah. And how are you, Shirley? Okay, I guess she stepped away. So Torres, are you going to take him through an exercise like you normally do, or are you just, no?
Oh, it wasn't on the schedule.
Oh, well, it's always, that's what we do.
It wasn't on that scripting.
Okay, so No worries.
We're a minute away from
Yeah.
restarting.
Okay, that's fine.
I was just going by the script. My apologies.
It's all good. No worries.
We'll do it at the end, just so that everybody wakes up for the
Did
day.
everybody see the link in the chat box for the evaluation? Okay, you could just show me your hands. Yeah, you got it. Okay, I'll resend it again before the presentation is over. So those people that didn't get an opportunity, they can still. Just open for questions. Oh, no, Judy, yeah, we want you to finish and then we can be open for questions. Yeah.
Great.
You can begin.
Let me reshare the screen. Oh, all right. Can you all see my screen again? Moving quickly.
Yep.
All right. All right. So here's another test that we give. It's the California Verbal Learning Test, or we call it the CVLT. This measures verbal learning and memory, but it also taps into repetition learning, a serial position effect, meaning, do I remember the things at the beginning or the middle? Or the end. Most people remember things at the beginning or the end, generally not the middle. So if you ever want to tell people things, always start with it or end with it. So what we do with this test is we read a list of these words and then ask the patient to repeat it back to us, read the list again, do it again, read the list, go back, read the list, go back, read the list, go back one more time. So this, I know, seems a little bit annoying, but the hope is that if you get the information just once, you might remember some of the words, but if you keep repeating things, that it'll improve. But that's not always true for everyone. So we have to figure out why. Why is it the case? So Tony had asked, like, well, is repetition the key? Yes, usually repetition is key to some memory things, like rote memory, things that I just need to use quickly and then could toss away out of my brain. But things that you want long-term memory, that's you need to learn and integrate it into your system versus just memorize it. But in school, when kids are more rote memory, these are things that are important to remember, to know if they can do this, because if they can't, then we need to do something else to help them learn or to boost a different learning method for them, because they are capable. They just learn differently. This is another test that we give. It's the Ray Complex Figure Test. So at the bottom is the figure that we actually ask people to draw. We ask them to copy it. Then we ask them a couple of minutes later to recreate it from memory, and then 30 minutes later, recreate it again from memory. This measures visual spatial recall memory, visual spatial recognition memory, response bias, processing speed, visual spatial constructional ability. This is not a patient that we gave it to, but this is going to just show you what how someone can do. So like I mentioned, at the bottom is the figure that we ask them to draw. We put the piece of paper in front of them and we just say, go ahead and draw it. And then where it says self-initiated, that's where that, it was I think like a 7-year-old kid. He drew that picture. This is what his brain saw, and this is how his hand drew it. If you look at it, you're going to be like, oh my God, what's going on with that kid? He can't draw this easy, simple picture. But you have to remember what is going on deeper. So right there, you'd be like, this person's brain is not working real well. However, when they verbally mediated it, meaning, okay, we help them organize. Okay, where do you start? Where should we start? And someone might say, okay, let's start with the big triangle. So we start there. Then we start with the next piece. Okay, then what comes next? And then what comes next? So if you kind of help some people, what we call scaffold learning, you kind of do something, move on to the next step, do something, move on to the next step. You help them break it down. It's much easier. So when you look at the verbally mediated picture, it doesn't look like the same kid. It looks like someone completely different drew it. But it kind of just goes to show some things I can't do by myself, but when I get help, I could do much better. But we only look at the first thing and we assume they're not putting enough effort, they're just not good at this, what's going on with their brain. So again, this is why we kind of need to break things down and help people understand how they learn better. This is a clock drawing. Often people are like, what are you going to learn from me drawing a clock? Yes, MRIs can show all this as well. But if someone has had a stroke, as you can see on line where it says score of 2, and then it's the first picture where all the numbers are on the right side of the page of the clock, that is telling us, without using an MRI, that they have what we call hemineglect. So their left side of their brain is not visually processing what's going on the right side. The simple clock drawing already shows us that. I don't need to sit in line for an MRI to show this. Obviously, we also want them to get the MRI, but these are kind of things that can help us show what's going on in your brain in a kind of simple, quicker ways. Because I know a lot of people are like, well, how is drawing this going to help? Like, it doesn't seem very sciencey. That's why we were called the soft science for so long. But when you actually look through a lot of the research and how these things were developed, there's a lot of science behind this. So kind of want to pull a little bit of a presentation, just because often people don't understand what neuropsych testing or screening is. A lot of people are scared about doing it, which is totally understandable. I don't want to know what is wrong with my brain either. But at the same time, I also think, but if I do, then I can do something about it. So it's why it's important to kind of let people know what this is, again, to destigmatize what it is. So this is one of the patients that we did test as part of this grant. She was actually our first patient. So she was our guinea pig. She is a delightful young woman. She was 20 years old at the time of testing, graduated high school, wanted to go to college, but unfortunately the pandemic had just happened, so she had to postpone that. The reason she was referred was because she was having a lot of healthcare issues. She was, what they said, quote unquote, overutilizing the ED. Our sickle cell team didn't say that. I think the ED team was concerned about that because she was coming in pretty frequently, which was true. I think to think about it and from a provider perspective is like, we just don't, it's not that we don't want her coming into the ED. We just don't want her to live in the ED. Like, that's not a life. We want her to feel well and not have to come here all the time. But a lot of her health issues were legitimate health issues, but there's also a lot of people felt she had a lot of anxiety, and that's why she was coming to the ED, because she was just overly anxious or having panic attacks or anxiety attacks, which were part of it, but should not have colored the entire picture, because we actually did find eventually some other things that had happened to her brain that even she or the team didn't know about, but she had advocated for herself. She kept going to the hospital and saying like, no, something's wrong. So moral of this story is to trust your gut, get what you need, advocate for yourself, but also as providers, we need to help her as well. So we did the testing with her, and we diagnosed her with mild neurocognitive impairment. So this is a 20-year-old. Usually we give mild neurocognitive impairment to people who are generally older, who have had strokes, who have had some type of dementia or some kind of traumatic brain injury. But this 20-year-old had this. It does not mean that she can't still live a good quality life and she can't function. It's just that she has to learn different ways to deal with things so that she can be more efficient and effective in her everyday life. We also had diagnosed with anxiety, which she already knew about, but we talked about how both of those get impacted in her everyday life. So she displayed impairments, and there's a difference between an impairment and a difficulty. An impairment means that it's impacted enough that it's impacting your daily life on a bigger scale. A difficulty means like once in a while you'll have a problem with this. So she had impairments on executive functioning tasks, working memory, processing speed, and perceptual reasoning. Those are pretty big things that I think if anyone thinks about like how would all of that impact my daily life. She had difficulties with visual motor integration and construction skills. She definitely performed well below expectations on tasks of academic achievement, even though she had graduated high school. They had passed her along like it was nothing, even though she struggled, even though she could have been taught differently so she wouldn't have had to just keep getting passed on for like a social promotion. She definitely had neurocognitive deficits associated with lesions in the left frontal and bilateral temporal lobes, which they had not recognized early on in her utilization of the ED, but eventually when she advocated for herself, they were able to do an MRI, and they actually did find things that hadn't been on her past MRI. So it's not like she was crying wolf by any means. She actually had these issues going on. So when you have deficits in those areas, it impacts your executive functioning, which we again already knew about, her memory, her processing speed, her verbal fluency, visual perception. She had anagnosia, which means she didn't recognize how bad things were, which is understandable because one, I think from an emotional standpoint, no one wants to accept those things, but her brain literally did not allow her to understand and see how difficult things really were for her. And she definitely had symptoms of anxiety and depression. She did have an IEP throughout her entire schooling, from grade school, middle school through high school, that literally said she had sickle cell disease. And yet when we asked her to get we asked for copies of these IEPs and we went through them, there were things that were really offensive, I think, like in black and white writing on someone's records. It said that she wasn't trying hard enough, that she skipped so much school, that's why she was so behind, even though, again, they knew she had sickle cell. So obviously, if you know someone has sickle cell, obviously they're going to not be in school sometimes because of their chronic medical condition. So don't use as an excuse for them why they're not learning properly according to them. Like that's also on the school, because that's your job. So all these findings were consistent with her self-reports as well as what was described in her IEP findings, but yet they didn't give her the proper supports. They were definitely just discounted because of all of those things, and they should not have been at all. But she didn't have someone in her life at that time to advocate properly for her, which is unfortunate because obviously that impacted the rest of how she felt. But as I mentioned, we don't just identify weaknesses. We also identify strengths. So for her, word reading and some aspects of executive functioning were her personal strengths. She said that she loved to read. So we definitely said, like, keep doing that. That's actually a protective factor. She expressed having a positive outlook and was interested in continuing her education. And she was a delightful young woman. You wouldn't even tell that she had all these issues and concerns because she came off as your typical bubbly 20-year-old young lady. You're starting off life, just ready for whatever comes at her. But she definitely struggled, and you wouldn't have noticed that because of how she presented herself, which I think a lot of people tend to do. We overcompensate in other ways so that no one knows how much we're struggling in other ways. But again, if we just talk about these things, then there wouldn't be so much stigma. She constantly scheduled and followed through with all of her clinic appointments. Even though she was in the ED once or twice a week, she would still come back to the hospital for her clinic appointments, which I think is amazing because most people would not. She was described as a skillful listener and took notes when she had questions, which I think is a rarity. I think generally we think about older people doing that, not a 20-year-old, but she did because she already kind of suspected that she had some issues. So she was, being proactive about that. She actively participated in her medical care, often saying how she was concerned about her health and engaged in whatever we kind of presented with her. And lastly, she said she felt better about learning her cognitive issues because previously she had assumed she was just lazy or not smart, which is heartbreaking to hear. A 20-year-old young woman to think that she is lazy and not smart because of what other adults told her as a kid based on their perceptions of things versus the facts, meaning that she had sickle cell, that she had an IEP, that they didn't really support her in properly with. How is that going to then impact her for the rest of her life? Her self-esteem, her ability to get jobs, to go back to school, all of that. Had she been someone who maybe fell more into depression, things could have been worse. But she, again, compensated in some ways to make it work for her, and it shouldn't have been this hard. She should have gotten those supports earlier on. So what are the benefits of this type of evaluation? I think health in and of itself is always really important. I know it's, again, scary to learn about what is wrong with our bodies or our brains, but it's really important because then we can do something about it. Like I mentioned, early intervention, identification, diagnosis, prevention, all of these things can really change the trajectory of our brain health, our physical health, our mental health. It's really important, I think, to understand your strengths and your challenges. Oftentimes we laser focus on our challenges, which is understandable because it's just easier in some ways. Then we're prepared for the worst, but the worst generally doesn't always happen. It happens sometimes, but think about it this way, if we focused on all the positive stuff, how much different our life would be. I know it's hard, it's easier said than done, but it's also like, if you took all that energy and to put it into that for even just a week, see how things feel. We definitely want to make sure people that know that the best way for them to learn, to do their best at school or at work, because obviously your brain impacts all aspects of your life. We want you to know what you do really well, because you should we should know our strengths. We should be proud of our strengths. I don't think it's cockiness. I think it's just being aware that this is what I'm good at. But you also need to know what your challenges are so that you can start kind of working on them. And we don't need to get a challenge to a strength. It's very unlikely that we'll get a challenge to a strength, but we can improve it so it's good enough. And sometimes good enough is okay. We don't need to be 100% in everything. This also will help you qualify for things such as an IEP or a 504 plan at school, including all the way through grad school, if that's what you plan to do. If you're not in school, but it can definitely help you with work, SSI, and other types of resources that you can access once we know what your challenges are. I think it's also important to just increase our health knowledge, and it helps increase our adherence to appointments and medications and improve the quality of life, because that's what we're looking for, is quality of life. And then unfortunately, I think we always have to kind of bring it back to the disease. And since sickle cell does have a shorter lifespan, this could help increase that lifespan. It helps prevent and reduce mortality rates. Because if people have been forgetting to take their medications, well, yes, it's going to decrease your lifespan. But if we identify, hey, they have this memory problem, then we can think about different ways to increase their medication adherence to improve their quality of life and their longevity in general. So when should someone be referred? I'm hoping that at some point everyone just gets referred because it's just a standard of care. But since it's not currently, you definitely should be referred when you're having difficulties with learning, attention, behaviors, socialization, or emotional control, because that is, again, an underlying issue of your cognitions. Definitely after a brain injury or trauma or a stroke. I know it's a lot harder when it's silent strokes, because people often don't even know that they've had a silent stroke, but there's small nuances that do occur that you kind of start noticing. Oftentimes people will be like, oh, it's just me, or I'm getting older, or I'm just stressed out. And those could be part of it too, but could also be something else. So that's why it's important to kind of talk about these things. Definitely when there's a recent or long-standing but poorly misunderstood changes in cognitive or behavioral functioning, either noted by you, family, friends, providers. What I tell patients is that when you're in the middle of the storm, it's hard to see outside of the storm. So that's why we want to ask somebody outside of the storm how they see things. Oftentimes people are pretty spot on with each other, but sometimes there is a little bit of discrepancy. So we always just want to kind of figure out, well, what is going on there with that discrepancy? We definitely want to refer when a provider suspects that something might be going on, but the brain scans show no abnormalities, because research has shown that even if no abnormal findings are not found on neuroimaging, patient scores are still lower on various domains from the get-go. So it's really important to kind of recognize that, because here in America, we love to wait until critical disaster hits and then do something about it. We're really trying to advocate to do something beforehand so it doesn't get to this place. So I kind of gave you a lot of heavy things to think about. So here's the positive things. All of this can be helped. So what can we do to improve our well-being, our overall well-being, our physical health, our emotional health, our mental health, our brain health? I know that we've all talked about this, especially through the pandemic, but self-care is vital. It is not prioritizing and being like, it's all about me, but it should be all about you. As far as I'm aware, we only get this one life. If we get something afterwards, great. But right now, I don't know that. So right here, I'm going to take care of this body and this brain for right now, because she takes care of me all the time. So thinking about what self-care means to you, it doesn't have to be this little list. And this is not an exhaustive list, but anything that helps you feel a sense of peace and relaxation, even if it's for a couple of minutes, it's worth it. Because the way our brain works, if I am happy and feel a reward from, let's say, sitting down and eating a piece of chocolate for 5 minutes, my brain literally is going to light up and say, ooh, that feels nice. Let's do that again. It'll remember that. So the next time I may be in a bad mood, it remembers like, hey, you remember you had that piece of chocolate and it made you relax? Let's go get a piece of chocolate. And that'll help, again, calm our body down. But there's, again, lots of other ways to do it. Exercising is really vital. It's not just for our physical health, but it reduces our cortisol and adrenaline. Those are the stress hormones, and it increases our happy hormones. That's our endorphins. There's also something called BDNF. It's brain-derived neurotrophic factor. It's like a little cleaning crew for your brain. It always lives in your brain. It does its job, but when you exercise, it gets boosted. So then you get extra cleaning people kind of in there scrubbing away. So that's why exercise is important. It's not just mental health benefits, but also cognitive benefits and physical health benefits. And I do not like exercising. I'm not a type of workout person, but I also know it's vital to me. So what the American Medical Association says is 30 minutes a day is all you need. So look at it from a different perspective. 23 and a half hours a day, you got to do nothing to stay healthy. So 30 minutes doesn't seem so challenging when you look at the other perspective. And I always say, even walking is considered weight-bearing exercise. As long as your heart's pumping a little bit more than when you're just sitting and resting, then that's exercising, and that's good enough. Mindfulness meditations, and that doesn't mean just sitting there quietly with your eyes closed, because that can be very, very hard. I can't quite do that either, but there are different ways to meditate. Walking meditations, sitting in a room and really just saying, there's a white lamp, there is brown carpet, there is a green plant, there is this, because that puts you into the present moment. When we are in the present moment, we are not focused on our anxiety looking towards the future or our worries about the past. We're centered right here in the moment. The more we can be present in the moment, the more we can kind of focus on what the here and now is. As a therapist, I gotta just shout out therapy because it's important. We all need it at some point. We've all done it, should do it at some point. It should be more affordable, obviously, but I'm hoping that it'll get there eventually, because the pandemic has really shown how important services this is. Sleep hygiene, we really need to get better at this, all of us collectively. These computer screens have made a big impact in our life in a positive way, but also in a negative way. So letting go of those screens an hour before you go to bed is going to really help you. Engaging in fun activities, whatever that means for you. Nature is a great, great source of health and wellness and tranquility. You get a lot of benefits. There's a lot more research on literally spending 30 minutes in nature is the equivalent of taking a Xanax, which is an anti-anxiety medication. I mean, it's free outside. Anxiety medications aren't as free. They're also a little addictive. Nature is not. So it's just something to think about. There's other ways to do this in a cost-effective way. And identifying support systems. I know not everyone loves people. I get it, but at the same time, people are vital. We literally evolved to communicate so that we would be in community together all the time. So it's really important to kind of work on our self-care all the time. And as I mentioned, as a therapist, it's really important for me to kind of plug away our services, because it's not just about talking about feelings, but as I mentioned in neuropsychology, we're looking at attention issues and problem focusing. So a psychologist, a marriage and family therapist, a social worker can actually work on some of these things to not just improve your emotions, but also your overall cognitive health. So what we do as therapists, like as a talk therapist, we evaluate your needs and provide recommendations. We provide diagnoses. We do different treatments such as talk therapy, learning coping skills such as pain management, improving our memories, improving our emotional control. What we tell people when we work with people with pain management issues is we can't take the pain away, but we can learn how mental health impacts the pain, because it does, and then learn how to better manage it and how we deal with it or react to the pain. It's kind of like watching TV. We can't turn off the volume, but we can turn it down. We definitely want to provide linkage to services and providers, because we know that you're not just coming to see us for one issue. Most people don't come in for just one issue. We definitely want to measure and monitor outcomes and report back to your team, whoever that is, the school, your family, your medical providers. We are happy to talk to whomever, as long as you authorize us to do that. And then we definitely want to provide collaboration with your medical providers or your psychiatric providers to let them know this is what we see. Here's how it can help you with your part of the pie. We're working on this part of the pie, and ultimately we want the whole pie to get worked on. And then we definitely want to make sure that we provide holistic care, because there's lots of different ways to deal with our feelings. And this is for people in general, is to how to advocate for themselves, because self-advocacy is so important. We're not always going to have someone with us. So it's really important to kind of advocate for ourselves, because you know yourself better than anybody else. You live in your body and your brain 100% of the time. I know, as I work a lot with kids, and yes, we look at the parents and say, like, what's going on? But then I also look at the kid and say, like, and then do you agree with those things? And is that the truth? And what do you also see? Because they're different perspectives. And as I mentioned before, oftentimes they are pretty spot on and close on the same problems, but they also have different viewpoints. So we want to make sure that we are addressing everyone's kind of concerns. So just making sure that self-advocacy is occurring, it makes you understand how you feel matters, and what you say is important, because it is, from our itty bitties to our older folks. Everything is important. Like I said, you are an expert in yourself, so it's important to kind of advocate for yourself. Oftentimes I hear, well, they're not going to listen. I'm like, it's not about whether they listen or not. It's about you saying what you need to say, making sure that you walk away from the table saying, at least I said it. They might have not heard it, but I said it. So it's really important. Asserting yourself when people aren't listening to you, and making sure that you advocate by understanding your own needs, making sure that you value what's important to you, and so that you can know what your rights are. Even expressing negative thoughts and feelings in a healthy and positive way, because oftentimes when we express ourselves in a too angry way or a too sad way, people are already kind of looking at us in a certain way. But it's about, like, okay, calm down, take a deep breath, and then restart over. Because if it's important to me, then I need to say it until someone hears it. Always being prepared. It's like playing in a game. You don't practice just the day before you have a game. You practice constantly, so that when a game is there, you're ready to go. I know it's hard to always do these things, because our feelings kind of impact our cognitions. And so we kind of shut down sometimes when we're overly anxious and trying to advocate for ourselves, and we can't feel like we're getting our words across properly. But again, just kind of reminding yourself, you're doing the best that you can, and you're advocating. And if you can't do it for yourself, then look at other people in your life, see what they do. What are the things that they do well? And then try to mimic some of that until you feel more confident in your own skills. And lastly, is just a summary. Just want to again note, like, you all are important. Your mental health is important. Your physical health is important, including your brain. Treatment for the management of mental health disorders and other illnesses can reduce your physical related issues. And neuropsych evaluations can improve their quality of life. Just want to sink that in for a moment, because sometimes we forget that we are important, especially if you have other people you're caring for in your life. It is not selfish to prioritize yourself. It doesn't have to be me being in the one spot or them being in the number one spot. We can both be in the number one spot. That's why there's ties all the time. It's okay to put yourself as equally important as everyone else in your life. And then here's just some national resources, as well as some local Bay Area resources for mental health issues. Just some references that I have that you could look back at. Some of them might be outdated at this point, just because research is constantly changing. Just want to acknowledge all the families and individuals living with sickle cell, because without you all, I would not have a job and be able to advocate for you. But I've definitely learned a lot in these last several years of working with our patients, and I'm very grateful to have been in their lives to kind of work with them in various ways. And lastly, thank you for listening. I know some of this can be dry sometimes, but hopefully you gained a wisdom in some ways. And if anyone has any questions, let me know.
I have some questions. Do you have any suggestions in terms of changing our relationship to pain in a more helpful, positive, less destructive or damaging way? Or,
Yeah, I think, obviously acknowledging that it's real, it exists. It's not just in your body, but it also lives in your brain. Because the way we look at pain is, technically it's mainly in your brain because that's where all the nerve receptors are, but you feel it in the rest of your body, obviously. And what I tell patients sometimes is like a heartbreak versus a physical arm break to your brain is the same thing. It says pain. But we manage both of those differently, right? So it's really stepping back and thinking about what kind of relationship do I have with my pain? I think most people have a negative experience with it, which is completely understandable. But it also has taught people some things, right? The reason we have pain receptors is to let our body know that something's wrong. It gives that a little alarm so that we can do something about it. It doesn't stay in that system long. Pain gets processed in about 90 seconds in your brain. The actual whole loop, it says something's wrong. This feels like I'm in pain. It goes through your loop and says, okay, it's done. But we hold on to it in other ways because there's an emotional impact to it. There's a cognitive impact to it. There's a social impact to it. So really thinking about different ways to kind of think about our pain, I think can be important. There's really good podcasts that talk about pain. There is a psychologist named Dr. Zoffness, who that's all she does. She only works with pain. I don't know if she's had a lot of work with sickle cell patients, but one of the podcasts that she has talks about the breakdown of how our brain processes pain and different ways to manage it. And one of the big things that she talks about is there's a theory called the pain gate control theory. So it's kind of like your brain opens the gate to let the pain in because it has to, because it alarms us if something's wrong, but it then closes it back up just enough so that it doesn't overwhelm and flood us, because it needs to kind of slow it down a little bit so not everything comes in. So one of the ways we can kind of close that gate a little bit is distraction. I know it seems very like, it doesn't work, but it does. Think about it this way. If you're really, really, really hungry, but let's say you're in a meeting for the next hour and you're like, I just don't have food next to me. I just can't get up. If you sit there and think about hunger the entire time, you're gonna probably get hungrier because that's all you're focused on, right? You're like, oh my God, I just can't wait to eat. And your stomach starts to rumble and you're getting irritable and you're like, God, just let this be done. But if you say to yourself, okay, I only have 45 minutes or an hour left to go in this meeting. I know I'm gonna eat a sandwich as soon as I get out of here, but right now I'm gonna focus on what's being said in the meeting. When you distract yourself, your pain receptors kind of shrink down a little bit because it doesn't focus on them. It's just focusing on something else. But I know with sickle cell pain, when you're living with it constantly, it's hard to turn off that dial as well. So it's really figuring out how to do prevention care. Taking medications consistently, exercising. I know a lot of people are like, but it hurts to exercise. And I'm like, yeah, that makes sense. But it's going to hurt more if you don't move because it's going to get stiffer and stiffer and stiffer, and that's going to hurt more. So even just slightly stretching until you get into a better place where you can kind of manage it a little bit better. There's also pain services. They're becoming more of service because we've recognized in the medical field that pain is not well addressed. Up until the 80s, we didn't even think about asking about pain, and we don't even ask about it well today. 1 through 10 isn't very scientific. So it's something that hopefully in time they'll improve upon. But what I also mentioned is, trying that self-care because that will help manage pain too. I'm more into holistic things. I also believe in Western medicine, but I also believe that our ancestors knew a lot of stuff with plant medicines, acupuncture, prayer, meditation. All of these things are just as beneficial, if not more beneficial in some ways than medications. There's just not a lot of research on it because, as we know, research is given to certain people, not others. So it's really thinking about how to think holistically. Like I'm a big advocate of acupuncture or acupressure. if you don't like needles, but acupressure still is effective. They have ear seeds. Massage is wonderful. Swimming. I know that you have to, make sure to get out and dry yourself off and all of those things too, but like swimming is a wonderful exercise in so many ways. So different ways to think about your pain, not just from a physical standpoint, but from an emotional standpoint and how it impacts your life in other ways. Sorry, that was a long-winded answer. Hopefully some of it helped.
I think Janelle had a question.
I just had part two, if I could just throw this
Oh,
in.
I'm sorry. Go ahead, Shirley.
I just wanted to, in line with that, I wanted to know if you, what your thoughts were about, in terms of stress or toxic stress, especially, what is the cycle of recovery when you get trapped in a toxic stress cycle? Say you began implementation of resolution. Usually, how long does it take before you're on the other side?
Oh, I would wish I could tell you what the answer is, but I don't think there is an answer. I think, what I tell people is like, none of this happened overnight. None of it's going to go away overnight. It's a process. Be patient with yourself, be patient with others and with the process. The most important thing to focus on is that you're doing it. You
Right.
started it. You took the first step. You've identified that there's a problem, and now it's a matter of moving forward. You will absolutely go backwards at times, and it is expected to go backwards. But hopefully you won't go as backwards from the start. You maybe only go 1 pace back instead of 5 paces back. And this way, when you go forward again, you're not starting from the number 1 standpoint again, because it could feel like that, but it's not. It's again,
Right.
putting things in perspective a little bit.
One last thing. I wanted to know what your thoughts were about 3 other things. I see you're very open and promoting holistic approaches, integrative medicine.
Mhm.
What do you think? I'm looking at learning EFT, emotional freedom technique, tapping,
Yep.
and I also wanted to know what you thought about that and other kinds of energy work. I heard you talk about acupuncture. What about Reiki and essential oils? And lastly, what do you think about some new therapy I've heard about called ACT, acceptance and commitment therapy?
Yeah, I think all those are great. I think you got to use what works well for you. I think they all have legitimate uses. I think aromatherapy, again, our ancestors didn't have access to pharmaceutical companies, and yet they still survived. They figured out plant properties and use them. All of our current pharmaceutical medications are based on plants. So it is so important to think about essential oils and helping. If it helps you calm down, then there you go. It's useful for you. Energy work, I think, is also important because, again, if it feels good for you, then it's helping. I think, if you're spending thousands and thousands and thousands of dollars and you can't afford it, well, that's probably not the best thing. But really thinking about different ways that help you relax and calm down, because I think there is going to be research in the next 15 to 20 years that talks about all of these things. I've been doing acupuncture since I was like 2 or 3 years old. My mom was quite progressive for her time. And what I've known and done research about, so chi is like kind of that life force energy. In yoga, it's all the chakras. And in Western medicine, it's called your vagus nerve. They're all the same systems, but just named differently. They all do the same stuff. But we want to be like, no, this is ours. I'm like, no, it's all the same stuff. Let's work together. So I think it's important to kind of do those things that help you feel better. I'm a big advocate of all that stuff. I just wish it was more affordable, and more Western providers were into doing both. Because
they need to, and people out there don't necessarily want to take all those pharmaceuticals. And I've said it before, and I say it again every time, because I went to I'm an aromatherapist. I'm into essential oils, and it's so obvious that those are very basic, and that's where it all began. So why are we, getting so caught up in because I noticed that a lot of the doctors, they're totally against all of the holistic avenues, not against it, but they just don't support them because the data, it's not proven, and so on and so on. But if it helps you in the course and the process, and I tell you, aromatherapy has a lot of value, and a fragrance could take you to another level just in a matter of minutes. You know what I mean? Seconds, it's just, I stand by it all the time. I really do. And because I don't like taking over-the-counter meds. I don't like taking my doctor meds. I don't like taking any of these meds. I hate it. And I try to keep it to a minimum. So yeah. I get it, Shirley, and I get it, Judy. It's the way to go, and I think it's a healthier process as well for your body, because when you're putting in all of that stuff in your system, how's it all working together? What is it doing to my system? I know I'm taking it for this and that. And that's what my heart goes out to these people living with sickle cell, because there's so many meds that they have to take. It's like unreal. Can't we reduce some of that and simplify this a little bit, and get away from all of that, because it's, while it's helping, I still feel like it's hurting. So,
Yeah.
I wanted to just say, Judy, I had tremendously beneficial experiences with acupuncture. I used to be a freelance court reporter a long time ago. And I got carpal tunnel, and I had one visit and she knocked it out. And I didn't have to have surgery or anything. It was she had to stabilize it. So we had some follow-ups, but I had all these wonderful side effects. I had energy, mental clarity.
Yeah, it's great. And it works. And I think
with the acupuncture, and I will say to everybody in this call, I had insurance. I think at one time I was in between the gap. And so I think it was Medi-Cal that actually paid for acupuncture.
Yeah, you're correct. Medi-Cal actually does some holistic, does support some holistic medicines. California is like one of the few states that's actually forward thinking in terms of that.
Okay, and so Tony's got her hand up. Janelle, you had a question? Janelle? Okay, maybe she's up.
Going once, going twice. All right,
Yeah.
Tony, you're up.
All right, Tony, what you got a question, or you want
Yes, along those same lines, I'm really interested in where are we in these clinical trials with CRISPR? Because I keep saying to my grandson, there is a light at the end of this tunnel. We now know there is a light. And so there's something, you don't have to live with this all the rest of your life. I heard maybe a year ago that we had 18 months to 2 years before it was going to be released to the public in terms of being a therapeutic choice.
Mhm.
And so I'm just as somebody in the public, I don't know if you know this, I'm just trying to find out if anybody knows where we are in that timeline, so to speak. Or, am I in fantasy land? I'm hoping, okay, thank you.
No,
I'm
not
glad.
Fantasyland.
Okay.
I think with science, we always have to remember it's a bureaucracy.
That's
So
true.
it always contingent on funding. I think throughout the pandemic, things have shifted a little bit. So some things have been put off, but not put down. I know at Children's that we had an $18 million gift or grant or something to do some of the CRISPR. I'm like, $18 million. I'm like, that's great. How are we going to use that? And then I found out each person is $1 million. So they're trying to figure out how to reduce the cost. And that obviously takes the clinical trials time to figure that out. But we're in the process. I think they've identified some people and they're going to start doing at Children's some of the transplants. I think UCLA is doing some of them as well. I think it was us, UCLA, and maybe one more hospital who got this grant, starting off with smaller numbers, but that's kind of typical. I think I read recently that hopefully in the next year or so that things will be coming a little bit more kind of down the pipeline and a little bit more accessible, but it's still in the phases of collecting that data, unfortunately. Because I think it's not just because they've been doing these studies for at least, I know pre-pandemic, because another patient of mine had gotten a CRISPR type of transplant pre-pandemic, but then that only leaves a couple of years to see what side effects or everything else that's happened. So they don't want to release information until they're a little bit more stringent. And obviously after the pandemic, people aren't really believing in a lot of science right now. So I think they want to make sure that everything's, you know, as tightly packed and packaged well so that more people will be accepting of it and it could be a little bit more accessible to everyone.
Okay.
I'll probably have some information on that, Tony. We have a meeting with a pharma company, Graphite Bio. Isn't that their goal, Torres?
Yeah, their goal is to kind of accelerate a CRISPR type of version.
So yeah, we're meeting with them on the 18th. So I'll get some information for you. Okay.
Okay, thank you.
Yeah, it's sooner rather than later. And to kind of piggyback off what Judy said, part of it is the bureaucracy, but to go along with what Nadina said as well, the sad part about our country, about the medical, it's all about money and it's all about big pharma. How can big pharma make money? So, you know, if they can't make big money, they're not going to spend a lot of time unless we're, again, coming together as a collective unit and pushing people to be like, let's forget about money. Let's think about people's lives. You know, so it's the sad state of affairs, but that's the country that we live in.
Yeah.
So it is 1 o'clock. I don't want to keep anybody beyond the scope of time that we had originally said. This is a great conversation. Hopefully we can keep on going with it. Round of applause to Judy. Good job. Thank you. This was an awesome presentation. Very, very helpful stuff. Very helpful things. I only had one quick question, Judy,
Yes.
which I think other people may have also had. What if you come across people who are like, oh, I know I'm messed up, I'm so far gone, but you know, therapy's not going to do anything for me. How do you respond to that?
I think it's just acknowledging that that's how they feel, because I'm not going to go and be like, no, you're not, because then they're going to be defensive and be like, well, how do you know how I feel? So I just got to be like, I'm sorry to hear that that's how you feel. That sucks. Because they're often not acknowledged that they're having such a hard time. So just starting there is just being like, you know, it must be really tough to feel that way as much as you do. What have you done in the past to make yourself feel better? Has anything worked? And oftentimes they're like, no, it hasn't worked. I'm like, well, then maybe you should do something else. And then that's when you can kind of open the door and say, like, have you tried this or that? Or what would you be willing to try? Because I always think about people as teenagers, because we all have our inner teenagers still in us.
Yeah.
Or you tell them don't do something or to do something, they're not going to do it. So how do you get small children and teenagers to do things? You kind of gently reel them in and say, you know, maybe right now is not the time that you feel like that's going on, but like in the future, you might change your mind. Really figuring out what do they value, and what have they lost because of how they're feeling. Because when we look at it from like a loss factor, they're gonna be like, oh, I have lost a lot of things. I want to get back to something else. That can help a little bit, but it's really not about pushing people, because I worked in quote unquote the criminal justice system for many years as well. And I had kids who were court ordered to come see me for therapy because they were in probation, and almost every single one didn't want to be there, obviously. And I said, look, I have your file, obviously, but I want to hear from you. What happened? What's going on? Because this is just a piece of paper from someone else's perspective. I want to know what's going on with you. And I can help you with whatever you need. This is not about me and what I want you to do or what the court wants you to do or what the judge or your family, but what do you want? And then figuring out if the kid had said like, you know, I just want everyone to stop bothering me. I'm like, okay, well, how do we get there? How do you get people to stop bothering you? Stop like checking in on you? I'm like, that probably means you have to do something to show them that you don't need their help. So what can you do to prove that to them? And then they would come up with some ideas. So the more you just start kind of just listening and just getting their perspective, I think people start to open up. In our field, we always say you have 2 ears and 1 mouth for a reason. So doing a lot more listening is important than a lot of talking.
Huh, that's good. That's actually good. Yeah, because most of the time you end up in an argument about why therapy is good and they actually don't do anything. Yeah, that makes more sense. Cool. Awesome. So some quick little updates for that. Again, thank you, Judy. Very informative. From the SCAA side, we have a couple of events. Sadly, the fitness day was canceled this month. A lot of different factors went into that, so we won't be having it this year. But we will have the Wine and Sign event, and that will be happening September 21st at Robin Ben's, which is located over in Emeryville. So that'll be September 21st. It'll be on our website, so come on out, support us. That is our pre-walk event, which leads us into our walk, which is happening September 24th at 10 a.m. over in over by 3rd Street over there. Nadina, what
Bayview
I forgot which
Opera
facility
House.
we're
It is
using.
over there by 3rd Street. It's at the Bayview Opera House.
It was at the, okay, sorry. I thought we had switched to the firehouse. So I just had a little, you know, I only got 3 hours of sleep, so my brain's a little.
There you go. There you go. So you don't need to be doing a lot of talking.
No, I was just kidding. I just used I used the information I used today to speak for my little hiccup there. Anyway, so it'll be at the Bayview Opera House over there in the Bayshore district. Again, it's our annual walk. Hopefully everybody can come, bring a friend, bring family members, bring everybody, bring one and all. And then also SF General now has on the if you go out there to the mezzanine, or if anybody is going to SF General, you'll see that they have an SCAA poster up of us there with information about our events, our website, who we are, et cetera, et cetera. So please check that out. If you have an Instagram or a TikTok or Snapchat or Twitter, take a picture, tweet it out, snap it out, Instagram it out, whatever you need to get the word out about us and our organization. Again, we will have information on that roundtable event that Adina spoke to about earlier on October 5th. Hopefully we'll see Judy and some of you there as well. Again, we are trying to keep it limited, but we do want patients there as patients, advocates, caregivers, professionals, interested groups that can actually come together, have a good discussion, and help move the dial forward for this community that needs it so badly. Go ahead, Nadina.
Let me just elaborate on that Wine and Sign, because you didn't really tell them what the Wine and Sign is. The Wine and Sign is, we usually have it the day before the walk, and we have a venue we used to use here in the city, but it's not available. Well, people would come in and make a sign for the walk and get a free glass of wine. So yeah, try to get everybody involved, and we had some really good turnouts. So really, we're making people, we got a lot of signs, but still, you know, it's an opportunity to sort of get everybody amped up and get ready for the walk. And there'll be a lot of activities at the walk, performers, speakers, we'll have food, and we'll walk. So yeah, all of you can come on out, and if you're available, and join. We would really love to have you, and we really appreciate your time joining us today. It was our pleasure to bring you Dr. Cavazos. Am I saying that right?
Yes.
Okay. And all of this great information, you'll be receiving her PowerPoint presentation. And once this is edited, this session will go up on our YouTube channel.
Thank you to everyone.
We're good? All right. Thank you so
day.
much, Judy. You did a great job.